Early diagnosis and good management of blood sugar can delay or prevent these complications. Welcome back to my channel. My name is Mirabe Bikono. On this channel, I talk about diabetes. I also post inspirational videos to inspire you, live your dream and a fulfilled life. Diabetes type 2 is a metabolic disorder in which the body accumulates sugar in the form of glucose in the blood rather than being used as fuel by the cells in the body. Diabetes type 2 is diagnosed using blood sample. In today's video, I will be explaining 4 main ways in which diabetes type 2 is diagnosed using blood sample. But before I go into it, I would like to make a disclaimer. I am not a medical doctor. I am speaking from my experience as a diabetes educator. First on my list is fasting glucose test. With this test, the patient is required not to eat anything for minimum 8 hours. A blood sample is collected from the patient. Normal blood sugar ranges between 70 to 100 milligram per deciliter. 100 to 125 milligram per deciliter is considered pre-diabetes, and results higher than 126 milligram per deciliter is considered diabetic. Number 2, the hemoglobin A1C test. Hemoglobin A1C test shows the average blood sugar in the past 3 months. Hemoglobin is a protein in the red blood cells that helps to transport oxygen in the body. Results under 5.7% are considered normal sugar level. 5.7% to 6.4% is considered pre-diabetes. 6.5% and above is considered diabetic after 2 tests. Third on the list is the oral glucose tolerance test. This test begins with the measuring of the fasting glucose, after which the patient will be given 100 grams of glucose to drink. After 2 hours, blood sample is collected from the patient and tested again. 140 milligrams per deciliter is considered normal blood sugar, while 140 milligram per deciliter to 199 milligram per deciliter is considered pre-diabetes. Results higher than 200 milligram per deciliter are considered diabetic. The oral glucose tolerance test is also used to diagnose gestational diabetes from 24 weeks of pregnancy. Number 4 is the random blood sugar test. This test is conducted randomly without taking into consideration when the patient last took his or her meal. A blood sugar level higher than 200 milligram per deciliter with diabetes symptoms is considered diabetic. I made a video in which I listed the main symptoms of diabetes. You can check it out. If one or more of these tests are positive, your doctor will repeat the test again to confirm diagnosis of diabetes. With pre-diabetes, you have a higher risk of developing type 2 diabetes if not controlled. Exercise and a change in lifestyle is advisable. When diabetes is not diagnosed at an early stage, or if the blood sugar level is not put under control, it can result to complications such as eye damage, also known as diabetic retinopathy. This can cause cataract or glaucoma. Kidney damage, also known as diabetic nephropathy. This can lead to kidney failure. Nerve damage, known as diabetic neuropathy. This causes a loss of sensation in the hands and feet, heart attack and heart failure, stroke, diabetic ulcer, which can further lead to amputation. But the good news is that early diagnosis and good management of blood sugar can delay or prevent these complications. For those who are diagnosed with diabetes, regular blood checkup, such as the daily blood checkup, can help to put your blood sugar level intact and help you also to manage your blood sugar level. Now you know the 4 ways in which diabetes type 2 is diagnosed using a blood sample. Contact your doctor or physician to prevent long-term complications of diabetes. Share this video with your friends and family. They might find it useful. If you learned something from this video, also give it a thumbs up. And as always, thank you for watching. Remain blessed. Live your dream. I see you on my next video. Ciao.